It's kind of startling when you actually look at the figures.
Hmm.
Every single year, something like 5 to 7% of adults right here in the U.S. face serious mental illness.
And it's similar for kids too, isn't it? About 5 to 9%, I think the numbers were.
Exactly. But here's the bit that really gets me. Mental illness ranks as the #1 cause of disability in the entire country.
Yeah, that's huge.
Think about how that, ripples out through communities, families, probably touches almost everyone's life somehow.
Absolutely, which is exactly why we're doing this deep dive today.
Right. We're getting into a really pivotal document, foundational maybe.
I'd say so. We're looking at the final report from President Bush's New Freedom Commission on Mental Health. It came out back in July 2003.
Okay, so 2003 feels like a while ago now.
It does, but honestly, this report, it really laid the groundwork for a lot of how we approach mental health care today, or at least how we talk about approaching it. It's packed with stuff.
Absolutely. So think of this as our way of giving you the quick version, the essential takeaways, saving you waiting through the whole thing.
Getting you the core insights from a really influential piece of policy.
And the commission, they had the central mission, right? Which was, frankly, pretty ambitious.
Oh, incredibly ambitious.
Yeah.
They wanted a complete transformation of mental health care
The goal being.
to make sure adults with serious mental illnesses and kids with serious emotional disturbances could actually live full lives, work, learn, be part of their communities.
And didn't they also really emphasize hope? Like the possibility of recovery?
Yes, that was key.
Yeah.
A really powerful message came through. Recovery from mental illness. It's not just wishful thinking. It's a real, achievable thing.
Which is huge. So how did this commission even come about? What was the background there?
Well, it was formed back in April 2002.
Yeah.
And it wasn't just, an academic exercise.
Right. There were real concerns driving it.
Definitely. People were seeing how fragmented the system was,
Hmm.
disconnected. And honestly, the care often just wasn't good enough. It wasn't meeting people's needs.
So they spent a year really digging in.
A full year. They looked at research, they held hearings, listened to hours and hours of testimony from individuals, families, professionals, trying to get a really clear picture of what was actually happening on the ground.
Okay, so after all that investigation, what was the main takeaway? The big problem they identified?
Their central finding was pretty blunt, actually. They called the mental health system a patchwork relic.
A patchwork relic.
Yeah, imagine like instead of a proper plan, things just got added on over time. Layer upon layer of different policies, different fixes.
So it wasn't designed intentionally?
Not really, not in a cohesive way. And the result, they argued, was a system that wasn't actually set up to help people recover long term.
So it was more about just managing.
Pretty much. Managing symptoms, kind of keeping things contained, rather than truly facilitating recovery. They even suggested it sometimes almost accepted long-term disability as like the default outcome.
That's a pretty damning assessment.
It really was.
And I guess from that stark conclusion, they started building their vision for something better.
Exactly. That finding was the jumping off point. Their vision for the future was, well, incredibly aspirational.
What did that look like?
A future where everyone, literally everyone, with mental illness could recover. A time where maybe mental illnesses could be prevented or at least caught really early.
And access to care.
Universal access.
Yep.
Everyone gets effective treatment, the right supports, no matter their age or situation, to live a full life.
That really speaks to, why we do these deep dives. Trying to get a handle on these complex things without getting lost in the weeds.
Precisely.
Now, you mentioned President Bush convened the commission. He himself pointed out some specific reasons why it was needed, didn't he? What were those big roadblocks he saw?
Yeah, he highlighted 3 major obstacles. First, stigma. The huge persistent stigma around mental illness.
Still a massive issue today.
Absolutely. It stops people asking for help, makes people feel isolated. Second, he pointed to unfair limits on insurance coverage.
Ah, the parity issue.
Exactly. Financial
Yeah.
barriers, treatment limitations in private insurance plans made it hard to get care. And third was the fragmented system itself, which we already touched on.
That patchwork relic.
Right. And he really stressed the human cost of all this, the impact on individual lives, on families, on communities.
And it's clearly not some small niche problem. The report makes that clear, right? It affects a lot of people.
Oh, massively widespread. It cuts across all ages, all backgrounds, races, ethnicities, economic statuses. No community is untouched.
And the economic impact.
Also huge. They estimated back then around $79 billion a year in indirect costs. mostly lost productivity.
79 billion. Wow.
And that's just indirect costs. On top of that, direct treatment costs in 1997 were about $71 billion. Mostly public funds, interestingly.
71 billion. And was spending keeping up?
That was another concern they flagged. Between 87 and 97, mental health spending hadn't actually kept pace with overall healthcare spending growth.
So potentially falling behind even then, that really paints a picture of the scale. You mentioned fragmentation earlier. The Commission's interim report went into more detail on that, didn't it?
It did, yeah. That interim report used the phrase fragmented and in disarray. Pretty strong language.
And what were the consequences of that disarray?
Well, they linked it directly to things like unnecessary disability, homelessness, people struggling in school, even higher rates of incarceration.
So real-world negative outcomes.
Absolutely. And they pinpointed specific gaps, areas where the system was particularly failing.
Like what?
Care for children, care for adults with serious mental illnesses. Older adults often fell through the cracks. Also, the really high rates of unemployment and disability for people with mental illness.
And just a general lack of focus.
Yeah, a lack of national priority for mental health generally and specifically for suicide prevention too.
And all this fragmentation, this lack of coordination, it basically undermined the main goal, which the Commission identified as
Recovery. That was the word they kept coming back to, the central goal.
Explain that a bit more. What did they mean by recovery?
Well, fundamentally, it's the ability to live, work, learn, be a full participant in your community. But importantly, they recognized it looks different for different people.
Right, not a one-size-fits-all thing.
Exactly. For some, it might mean living a really good, fulfilling life, even with some ongoing symptoms or challenges. For others, it could mean symptoms going away completely, remission.
And hope was central to that.
Crucial. They pointed to research showing hope itself is a vital ingredient in the recovery process. And they also talked about resilience.
Resilience.
Yeah, that ability to bounce back from tough times, to cope with adversity, keep going. Building that resilience was seen as part of the journey, too.
Okay, so we have the problems: fragmentation, stigma, lack of focus. And we have the goal: recovery and resilience. What principles did the Commission say should guide the transformation needed to get there?
They laid out two core guiding principles, really fundamental shifts.
Yeah.
First, care has to be consumer and family-centered, meaning the person, the consumer, and their family are in the driver's seat. They get real choices about their treatment, about who provides it. It's not just the system dictating things.
Empowering the individual.
Exactly. And the second principle was shifting the focus, moving away from just managing symptoms.
Towards actually facilitating recovery and building that resilience we talked about.
Precisely. Helping people cope, helping them build a better future, not just, maintaining the status quo of their illness.
Those sound like really important shifts in philosophy, but how did they translate that into action? They came up with 6 goals, right?
They did. 6 interconnected goals, kind of the pillars for this new system they envisioned. And the very first one was a big one, conceptually.
Which was?
Goal 1, recognizing that mental health is essential to overall health.
Seems obvious, maybe, but I guess it wasn't treated that way.
Apparently not. The Commission said we need to treat mental health with the same urgency, the same importance as physical health.
How do you do that?
Well, tackling stigma head-on was key. National education, public awareness campaigns, making it okay to talk about it, okay to seek help.
And integrating care.
Yes, integrating mental and physical health care. Training primary care docs, for instance, to spot and help with common mental health issues, breaking down those silos.
Makes sense. Creating a positive cycle, less stigma, more help-seeking, better integration. Okay, what was goal 2?
Goal 2 was making care consumer and family-driven, really putting that first principle into practice.
So moving beyond just saying it, what does that look like practically?
The cornerstone was this idea of an individualized plan of care for every adult with a serious mental illness, every child with a serious emotional disturbance.
Developed how?
In partnership, actively, meaningfully, with the consumer and their family.
Mm-hmm.
They get a real say in their treatment team, in the decisions being made. They can agree, disagree.
Giving them control.
Yeah, and they even floated the idea of consumers having more control over the funding for their services, directing resources where they feel they're most needed.
That's a pretty radical shift from traditional models. What else fell under this goal?
Making sure the system coordinates the care, not dumping that burden on the individual or family.
Oh, that's huge.
Isn't it? And ensuring access to resources, good health care, yes, but also housing, employment support, and keeping people out of the justice system unfairly.
And the Olmsted decision.
They highlighted that too. The right to live in the community, integrated, not just institutions. Also, tackling that awful situation where parents sometimes felt forced to give up custody to get their kids' mental health services.
Yeah, that's terrible.
They said custody and care access should be totally separate issues. And finally, strong protections around seclusion and restraint.
How so?
Last resort only. For safety, never punishment or treatment. Ordered by trained, licensed people. Protecting basic rights.
Okay, a lot under Goal 2. Goal 3 tackled another critical area, eliminating disparities.
Right. Ensuring fair access and good outcomes for everyone, regardless of race, ethnicity, gender, where you live, sexual orientation, all of it.
Because disparities were and are a major problem.
Definitely. The Commission noted that minority groups often carry a heavier burden of disability from mental disorders, so the need for culturally competent care was stressed.
Care that respects different backgrounds and values.
Exactly. Which also means needing a more diverse mental health workforce, people who reflect the communities they serve.
And reaching underserved areas.
Improving access in rural or remote places, using telehealth, which was pretty forward-thinking for 2003, and training local providers, even first responders, to recognize and respond to mental health needs.
Makes total sense. Okay, Goal 4 feels related. Early screening, assessment, and referral. Getting in early.
Absolutely. The idea was to catch problems sooner. Ideally in places where there's less stigma, like your family doctor's office or schools.
But also in higher risk settings.
Yeah, like the justice system, juvenile and adult. They pushed for routine screening for kids and adults, maybe as part of regular checkups.
In screening for co-occurring issues.
Crucial. Screening for both mental health and substance use disorders together, because they so often overlap.
And the benefit of catching things early.
Huge potential. Stop problems getting worse, maybe shorten how long someone is impaired, reduce suffering, reduce costs. It's a win-win, really.
So Goal 5 shifts to the quality of care itself. Excellent care delivered and research accelerated.
Right. This was about making sure the care people actually get is, well, good, based on what we know works.
Evidence-based practices.
Exactly. Consistently using treatments that research has shown are effective, and getting those research findings out of the lab and into clinics faster.
Which requires training.
Big time. Training the workforce in these effective, often newer treatments. Plus, continued strong investment in research itself.
Any specific research areas they highlighted?
Yeah, they mentioned needing more focus on disparities, long-term effects of medications, the impact of trauma, and better approaches to acute care. Basically, keep pushing the science forward.
Got it. And the final goal, Goal 6, looked ahead to using technology.
Yeah, leveraging technology to improve access to care and information. Again, pretty forward-looking for 2003.
How did they see tech helping?
Empowering consumers and families, first off, giving them easy access to good information about conditions, treatments, local supports.
And helping providers?
Improving communication between consumers and providers, using things like electronic health records for better integrated care, and telehealth, of course, to reach those underserved areas we talked about.
Bringing care to people where they are.
Exactly. But they also added an important caveat.
Which was?
Making sure privacy and security of health information were strongly protected in this digital world. Really critical.
Absolutely. So those are the 6 goals, a really comprehensive vision.
It really was. Taken together, they map out a fundamental shift towards a system built around recovery, driven by consumers, based on evidence, and using technology smartly.
Okay, so let's just bring this together for everyone listening. We've dug into this 2003 New Freedom Commission report, its core message. The system back then was a patchwork relic, fragmented, often getting in the way of recovery.
And they proposed this major transformation based on consumer-driven, recovery-focused care guided by those 6 big goals we just walked through.
Right. So the question we want to leave you with, kind of a provocation for you to think about, is this. Looking back from today, how much has actually changed?
Yeah. How have these ideas influenced the mental health landscape you see in your community, maybe in your own experiences?
What parts of this vision still feel like they need the most work? Where are the biggest gaps still?
It's definitely something to mull over.
We really encourage you to think about it, maybe even look up the report summary if you're interested. Understanding these foundational ideas, where things were heading, it really helps frame how we think about mental health and well-being today.
Absolutely. It's been fascinating to revisit this landmark report. It provides such valuable context for the ongoing work, the ongoing journey to improve mental health care for everyone.